Can I still pursue active treatment of my disease and receive palliative care?
As a matter of fact, you should. As you're seeking active treatment for a cure or at least to manage a chronic illness, palliative care should be part of that. You know, there was a time, maybe it was Marcus Welby, MD's time, when his care was palliative care, comforting his patients both physically and emotionally while he was treating them, benefiting their health, managing their illness, attempting to cure their disease. Palliative care doesn't come in conflict with any other care management. It supports the wishes of the patient and the comfort of the patient.
How frequently will I see my palliative care team or doctors?
That totally depends on where you live and what services are available. Community-based palliative care in offices, clinics, and in homes is quite rare in the country. And speaking of the country, in rural areas, it's just non-existent. So palliative physicians and nurses are usually in hospitals. They advocate, set up care plans, comforting palliative plans, but you may never see your palliative physician or nurse after an in-hospital consultation.
What will the role of my primary care physician be if I'm receiving palliative care services?
Well, your doctor should be involved with your care, especially if you've got a relationship that's back and forth. He or she is attached to you in this professional relationship and you to them. And that's a trust relationship. Well, if there is no palliative care service in your community, then your doctor is going to be your palliative care physician, supporting your wishes for the kind of care you want and comforting your distressing symptoms. If there is a palliative community service, then your physician should be engaged and involved, knowing you better than any other physician and understanding what your wishes and your concerns are. If palliative in your community means hospice care, then your physician can continue to be your primary doctor working with hospice, or they can turn that care over to a hospice physician who communicates regularly with your personal physician.
Who should I turn to if my doctors tell me that I don't need palliative care?
Your primary doctor, primary care physician, and the nurses that work in his or her clinic are your strong advocates, and you need to ask them to be that. If you've made decisions about advance directives, a living will, about what you do want and what you don't want in the face of serious illness, ask your primary physician to support that, to be your advocate. Doctors often want to heal and cure and not just comfort, but ask your doctor to support you and be there for you. And you certainly can ask your doctor to help manage your distressing symptoms, shortness of breath, nausea, dry eyes, pain. Your doctor can help you with that, but sometimes they need just a little nudge.